In our last video, you would have found about the TB spine or a pot spine. So, did you know that this spinal infection will cause walking problems? Hi, I am Jyoti Priya, physiotherapist working at PRS Neurosciences. So, in this video, I am going to tell about the walking problems which is caused by spinal infections. So, usually this symptoms will start with the pain. So, all the spinal infection symptoms will start with the pain, mostly the back pain. So, it is very important to go and see a doctor or consult a doctor if you have any back pain along with some of the lung infections, or we will say they will have repeated cold and they have any history of asthma. So, all this is related to this TB spine, which is a pot spine we will say. So, usually it is extended extrapulmonary manifestation, like it is not only because of the spine infection, the lung infection spreads to the spine and causes this. So, that will reflect as a pain first, then they will be feeling a tenderness over the area, and the other symptoms like abnormal sensations they will have, and it will leads to weakness in their both lower limb, which is the complete complete reduction of function and complete strength loss in their lower limb, which is called as a paraplegia. So, some of the patient it will cause some of the abnormal sensations and mild weakness they will have, but still they will be able to walk and manage their functionality, which is called as a paraparesis we will say. So, and along with this they will have the kyphotic, which is a hunching back, and the scoliosis, they will have a lateral curvature of the spine. So, these are the deformities also can be seen if the patient is having the spinal infections. So, why I have told all this causes and the symptoms are, so because of this the walking and their functionality will be affected. So, we have to treat each and every one according to their deficit, and then that will improve their functionality. So, as you take the pain, so while treating pain, if any of the pain aggravating exercises we have given as a therapist. So, while treating pain we have to be very cautious about the exercises which we are recommending for them. So, when they will have any aggravating factor because of this exercises, then immediately it has to be changed or it has to be addressed. And if they are having any deformities, so the first main goal is to correct the deformities, like too much of kyphosis there, too much of scoliosis there, the corrective braces can be given, and some of the correction exercises, spinal stabilization exercises can be taught. And if the patient have undergone any surgeries for the pot spine or any spinal infections, like decompression surgeries we will say, which is the infection which is spreading to the cord and it is compressing and it is causing all these symptoms, then the decompression surgery will be done. So, for this kind of patients, the complication prevention has to be the first priority, and it has to be followed throughout the acute to subacute stage. So, this is the main goal for the rehabilitation purpose. So, the spinal stabilization brace has to be given to avoid further harm. So, let us see about the paraplegia or paraparesis. So, paraplegia, as I have told before, it is a complete weakness in the lower limb, and the even bladder and bowel symptoms will be seen. So, for this kind of patient, our goal is to maintain their range of motion, and parallelly we have to work on their functionality also, like how they can turn in bed, how they can come up to sit, how they can do all this with the braces, and like sitting with the braces, and how they can do some standing activity or sit to stand activity with the braces and walking aids. So, these are the first level of rehabilitation which we have to focus on. Along with that, if the patient is almost out of the spinal shock phase we will say, and they have gained all the reflexes, then we can focus more on the bladder and bowel activities also, how independently they can go and do these activities instead of taking any support. So, these are the things we can focus on. So, especially if we will come into walking problems, so if one by one these things have sorted out, then automatically their mobility will improve. So, the patient and the caregivers also has to take part in their journey, and the as a rehab professional, we have to teach them what and all to be followed to avoid the complications, and what and all till which extent they can make the patient do the exercises, and when they have to stop the exercises, and to reduce the fear of fall, like reduce the falling, and even to reduce the fear of fall, what and all precautions we have to take. So all this we have to summarize this. I wanted to tell that as a caregiver and even a patient, the first thing you have to concentrate is to prevent from any complications because of this spinal injury, and they have to give a proper rest and relaxation during the exercises and even after the exercises. And so when the braces was given, it has to be worn properly, and the functionality has to be reduced. So don't push the patient too much and let them recover in a balanced way. So we have to mainly focus both on their independent functionality and the complication prevention also. So to know more about the spine injuries and other spine rehabs, please stay tuned. Thank you.